All right, so discuss the advantage and disadvantage of what? Of using interviews to gather data from people. What type of people? Who are in the hospital waiting room. So basically पूछते हैं कि भाई हॉस्पिटल वेटिंग रूम के अंदर लोग हैं, वहाँ पे तुम्हें इंटरव्यू करना है डेटा गैदर करने के लिए. सो बाय यूजिंग an interview method to collect the data from people who are in the waiting room in the hospital, what are the two advantages and what are the two disadvantages of using an interview? The reason why I say two is क्योंकि advantage के आगे ऐसे लिखा हुआ है, plural, so two advantage, two disadvantage. So yeah, I want you guys to like come up with your answers. क्या होगा using interviews? Suppose you're in the waiting room, right? Put yourself in that scenario. In-depth data. Can you a bit elaborate थोड़ा सा ज़्यादा? Demand characteristics. Oh yeah, okay. Okay, like थोड़ा description. I know what you guys are saying. Whatever you guys are saying is correct. कि ये होगा वो होगा, but like, can you like tell me how? Okay, people get more open questions are asked. Zabardast, right? You know what? You can get, because you're conducting an interview, right? So you can get information through the non-verbal gestures as well. Again, another source of information, right? Demand characteristics will involve how demand characteristics might lie about their health condition. Acha. So this is what I want you guys to do, right? And this is a good example. When you write the answers for, देखो यहाँ पे this is not a generic question, right? This is a very specific situation-based question. You know what? You're not saying okay, you're supposed to conduct interviews, and what's the strength and disadvantage of interviews? यहाँ पे situation भी है, you know what? Interviews from the people who are in the waiting room. So think of relate your answer to the situation in the waiting room. That's what they want you to do. What could cause demand cuts? Why would they lie in the waiting room, right? That people are in the, like, they might lie so that the people don't just. Yeah, okay.
Might open up and we can get their body language. And it could be our advantage.
Okay. What was the last time you heard? What was the last thing you guys heard? Okay, I don't know. I talk much.
I think I was
Catch it like anyways, all right. I'll just say it from the beginning, right? Basically, you know what? Her point, jo Zahara ka point, right? What she wrote in the answers, right? They might lie about, they might lie. So yeah, if you remember the Mr. Bean episode, right? जो teapots के हाथ के अंदर फंसा होता है. So वो छुपा के दिखाता है, you know what, the reason why I'm here in the hospital क्योंकि वो teapot मेरे हाथ में फंसा हुआ है. So everyone laughs as soon as they find out कि Mr. Bean के हाथ में teapot फंसा हुआ है जब वो hospital के अंदर है. So that's why, people might lie about their condition क्योंकि they might not prefer everyone to know. शर्म आती है, some XYZ, so that yes, क्योंकि सबके सामने वाला, they might lie. Another good example is that yes, you'll get qualitative data क्योंकि तुम्हारे सामने आंसर कर रहे होंगे तो body language, facial expressions, right? This all comes into data as well. And on spot, अगर तुम्हें open ended question पूछना होगा तो you can ask them. The good thing about interviews is that it's flexible, right? For example, questionnaires बांटोगे तो you'll be able to ask only the question that are mentioned on the questionnaire. Like interview के अंदर हो सकता है कि interview के दौरान you might realize कि you know what, I need to ask this question as well. So in that interview you have that opportunity क्योंकि you can have a semi structured unstructured interviews which might allow you to ask more relatable question to get more data. So in that regard, yes. Another disadvantage of using interviews to collect data is that you know what, confidentiality नहीं रहेगी क्योंकि they're gonna be in the open, so people can identify किसने क्या information दिया था क्योंकि सबके सामने हो रहा है ना, so confidentiality नहीं होगी. हो सकता है कि you know what, they are in the doctor's appointment, हो सकता है in the middle of the interview उनकी बारी आ जाए, they will have to go, so your interview may remain unfinished. हो सकता है. हो सकता है कि यू नो व्हाट इन दी इन वो दर्द में होंगे, एक्सट्रीम पेन में होंगे, राइट, पेट में दर्द हो रहा है, आप जाके उनसे सवाल पूछ रहे हो, ऑब्वियसली दे डोंट वांट टू आस्क answer questions, so that you might be inflicting psychological harm or burden on them, so you know what, that's one disadvantage as well. One advantage is that you know what, there is no way that these people are fake people क्योंकि obviously clinic के waiting room के अंदर are going to be genuine patients, right, जो जिसको मसला नहीं हो waiting room के अंदर क्यों आएगा. So you're going to make sure your data is kind of valid क्योंकि जो भी information आ रही होगी that's going to come from real people with real medical conditions. So whatever you want to find out is going to be a bit valid, right, in that regard. So that is somewhat going to be your answer. Two limitations of the study bias safer, as I said, वही मसले जनरलाइजेबिलिटी का, ठीक है ना, इंटरव्यू के अंदर वो मसला था डिमांड कैरेक्टरिस्टिक्स और थिंग्स लाइक दिस. Design a study using a questionnaire to investigate why men delay seeking help more than women. All right, so this is the question. You know what? You need to design a questionnaire. What do you need to find out? You need to find out more why मर्द ज़्यादा देर करते हैं as compared to women in terms of seeking treatment. First of all, you want to figure out is, are they asking you to compare any findings or discover any findings? What you guys think? Yes, a comparison study. You want to compare the genders, men and women. Yep. So your IV is gonna be men and women, the genders, right? And the DV is gonna be why the reasons why men delay more than women. So your IV is gonna be men and male and female. DV is gonna be the reasons why they delay. So yeah, so you're gonna do a questionnaire. So I told you what the IV DV is, men and female, right? DV is gonna be the reasons why they delay. You can ask, you can do this in the hospital, so it's going to be field experiment, right? It's definitely going to be an independent matrix design क्योंकि male का अलग group बनेगा, female का अलग group बनेगा, right? You are going to recruit people. So in your sample, I don't know, you have 10 male, 10 female, whatever, but make sure you write what medical condition they have, right? 10 male and 10 female who have coronavirus, something like that, right? Or who have symptoms of coronavirus. So the questions you can ask, ठीक है, should be relatable to the aim of the study. कोई बेतुके के सवाल नहीं पूछना. For example, right off the bat, you can ask के भाई, why do you delay? मर्द से पूछ सकते हो, औरत से पूछ सकते हो. Different reasons आएंगे, right? Uh, when was the first time you experienced the symptom? And when was the day you decided to go to a doctor? मेल से भी पूछ सकते हो, फीमेल से पूछ सकते हो, ठीक है ना? The day they decide, the day they experience a symptom till the day they decide to go to a doctor, उससे पता चल जाएगा कि कौन सबसे ज़्यादा डिले कर रहा है, ठीक है ना. You can also ask वो क्या कहते हैं, you can also ask what do you think, who delays more, females or males, तुम opinion ले सकती हो. right? So these questions can help you identify the reasons why they delay, and these questions can also help you understand why they delay. सबसे ज़्यादा delay किसका होता है, and what opinions they have of the other gender. So four questions as a मिल गए, right? Um, yeah, control that everyone was asked the same question. Ethic scale okay, no person was harmed, and for confidentiality, right to withdraw, privacy, वगैरह वगैरह वगैरह. And उसके अलावा I guess that's it. That's the major things that you have to write to say. So you can practice this question in your homework, right? Question slide number 59. Slide में दोबारा group पे upload कर दूंगा किसको नहीं मिला slide 59. You can practice it as well. Bharat. Now we come on to the second study of this section. Hypochondriasis. Hypochondriasis, taken. If you want to know what this means, I'm going to say it plainly. Illness, anxiety disorder. इसका proper नाम hypochondriasis था. अब illness anxiety disorder है, लेकिन क्योंकि syllabus थोड़ा outdated है, we're going to use the word hypochondriasis, right? So hypochondriasis is a psychological disorder जहाँ पे you have anxiety कि तुम बीमार हो के नहीं. It's not the normal anxiety that you and I might have regarding COVID कि वैसे हमें COVID तो नहीं हुआ. This is a real mental disorder. इसके अंदर क्या होता है? They have always they have a fear that they might be ill or they might get illness, right? So whatever symptoms they have, हो सकता है कि सांस एकदम रुक गया, चबाते चबाते उनका सांस एकदम रुक गया, और कहीं ना कहीं चलते चलते पेन महसूस हो गया. They're gonna think the worst negative outcomes, right? So they might figure, okay, सांस रुक गया, oh my god, I might have some I might have some disorder, problem, medical condition, हाथ में दर्द हो रहा है, कोई नस तो डैमेज नहीं होगी, things like that. So they are always in distress. हमेशा खतरनाक distress में होते हैं. They always misinterpret the symptoms. They always ask people कि मेरे साथ मसला तो नहीं है, despite medical doctors telling them that you don't have any problem. They don't have any other medical condition which ruins their perception of what is real and what is fake. As in, they're not abnormal in any case. उनको बस यही मसला होता है. They're not suffering from any other medical condition, and they're always preoccupied whether they have a serious illness or not, right? ठीक है. So these are their symptoms. So the way this happens is, whatever something is gonna trigger them. For example, they may read something on the internet and उनको लगता है कि उनको ये चीज़ है, उनको ये लगता है कि ये मेरे साथ चीज़ हो चुकी होगी. So when they read it, they're gonna feel threatened कि क्या पता यार मेरे साथ तो नहीं हो रहा. And when they feel threatened, they're gonna feel stressed. जब उनको stress होगा ना, so what they're gonna do, they're gonna increase their focus on their body. Is there anything wrong with my body? They're gonna check whether there's something wrong with the body, and their heartbeat and whatever things is gonna get increased. So whenever the heartbeat and whatever is gonna get increased, उनको लगेगा यार मेरे body के साथ वाकई कुछ ना कुछ गलत है. So they're gonna misinterpret their bodily functions, and they're gonna figure out that they're ill. And when they figure out they're ill, they're gonna have more threat. They're gonna get more stressed. They're gonna get focus on their body more. They're gonna seek reassurance behavior again and again and again, right? And this is going to stress them out more. जिसकी वजह से उनका heart rate ज़्यादा तेज हो जाएगा, breathing ज़्यादा तेज हो जाएगी. Then they might figure out, oh my god, I'm having a heart attack. जिसकी वजह से they figure out that they have a medical condition. So this is what happens. There is this one video that kind of relates to this study.
So what's the problem this time?
This time I really think I have something. I mean, I'm absolutely convinced of it. I mean, it's not like that adenoidal thing, where I didn't realize I had them out. But it was when I was younger. So.
I saw your father this week about his sinus, and he complained of chest pains.
Well, this guy's the real hypochondriac of the family. I mean, he's.
You mentioned on the phone that you'd had some dizziness.
Yes, a little dizziness, and I think I'm developing a hearing loss in my right ear. Oh, my left ear. My left. No, I'm sorry. It was my right or my left ear. Now I can't remember.
Okay, let's take a look.
Well, I'm sorry to say you have had a significant drop in the high decibel range of your right ear.
Really?
You've been exposed to a loud noise recently, or you had a virus?
No, I've been perfectly healthy. You know me, I